Article that we saw in Elle, also interesting because we do this a lot, is fat transfer, particularly to the face, which is where mostly we do our fat injections, both nano and microfat. So I thought that would be fun to talk about.
Yes. So I guess the first microfat is really fat that we use for volume, and nanofat's fat that we use for rejuvenation. Nanofat represents what's called the SVS-F, or stromal vascular fraction of the fat, and it's got the regenerative cells, the so-called stem cells within that. And microfat has the viable fat cells that live and give volume. Mm-hmm. I think there's a lot of people asking about it now because there's lots of sort of concerns about filler among some people. And I think we discussed in another video, I think it's because people have abused filler, put in too much filler. Most situations, filler is probably a better choice for the patients because it doesn't require a procedure to harvest the fat.
So when we harvest the fat, we get both the micro and the nano fat, which is great. So if we want to revolumize the face, we do micro first, and then we'll usually use nano fat underneath the eyes to help with discoloration, fine lines, crepiness. And we even sometimes go in at the end and stamp it into the face as sort of like a nano fat facial, which I think is really unique.
The other thing that was interesting in the articles, they talked about buccal fat. As Courtney knows, I discourage patients from having
that does not happen here.
Buccal fat removal doesn't, because the truth is, as we get older, we naturally lose fat in that area, and we see lots of patients who have had that done, maybe a couple of years before, and now they really regret it because they're so hollow there and need some sort of treatment to fix it. And even patients who didn't, that's a very common area that requests for volume replacement.